Good morning. I am Dr. Garcia Jr. of Plastic Surgery Art Center here in Webster, Texas. I'd like to explain a little bit more today about Botox and the dilemmas that we encounter when we do the treatment. It is important that we explain to you that it is best to be that this be done by qualified people, mainly physicians. Although there are some good Botox injectors out here in the Webster, Clear Lake, Friendswood area. There are several types of botulism toxin, and let me explain a little bit of how this works. The Botox, or the toxin, has been attenuated, and basically what this means is that the active toxin is no longer dangerous. However, you've probably heard in the past in Florida there were some people that were using off-market Botox, and there was a few deaths because of this. So it's very important that you make sure that when you select an injector, that you select a properly trained and qualified person. And like I said earlier, preferably a physician. Now, Botox works by paralyzing the muscle. It is not a filler. What it does is that it paralyzes the muscles in your face, and then what it does is that because the muscles are paralyzed, the wrinkles that are caused as a result of the muscle, for example, in the forehead, the frown lines, in the eyes, across crow's feet, and what it does is that while it paralyzes it, muscles can't act anymore, and then the wrinkling gets diminished. This normally lasts 3 to 4 months depending on the type of Botox preparation that you use. Again, you have to be very careful because if you inject it in the wrong spot, you can have some complications like asymmetry in your forehead. You can have complications of the Botox going into the upper eyelid, preventing you to bring the eye open all the way. It could do other things. Some people do react to the Botox, although this is very rare, and I've never seen it personally. The dilution of the Botox has a lot to do with the cost. The average dilution is 2.5 cc's of saline into the container. There are different Botox, like I was saying, and this gives it a 4 to 1, meaning 4 units per 0.1 cc. So this is about the standard. Now there are some injectors out there that will tell you that they can do Botox a lot less expensive, and what they're doing is they're watering it down. So what's happening is that instead of having 2.5 cc's per vial of 100 units, they usually double it and put 5, and then basically they're decreasing the price, making you think that you're going to be the same as the regular dilution, and then to find out that this is going to last only for 2 to 2.5 months if you're lucky. But anyway, we'd be more happy to evaluate you here at Plastic Surgery Art Center. Our number is 281-338-2766, and you can come here for a free consultation. Dr. Cecily or Sylvia, they'll be more than happy to get you scheduled. You have a good day.